All right, ladies and gentlemen, welcome back to another episode of Rise Urban Nation. I'm your host, Terrell Simmons, and today's episode is for anyone juggling the demands of entrepreneurship, leadership, and life while trying to stay healthy and sane. I know that we've been feeling that since COVID. And are you burning the candle on at both ends? Wondering how self care can actually make you more profitable and fluid? Well, today's guest has the answers. Joining us is Dr. Pamela. Now, I don't want to butcher the last name, Dr. Pamela. So, how do I pronounce it properly?
It's Buchanan.
Buchanan. That's what I thought it was going to say. But you know, I sometimes the syllables get in the way of my own pronunciation, and I'm excited to have this conversation because I know this is something because I'm in the leadership space, and a lot of leadership since COVID have been feeling that burnout too. But not only that, Dr. Pamela is a TEDx speaker, a physician, a mental health advocate who's on a mission to help people prioritize self-care, overcome burnout, and live healthier, happier lives. Dr. Buchanan's story will inspire you, and her wisdom will give you tools to start making self-care a priority today. So let's dive in. Welcome to the show. How are you today?
I'm doing great. I mean, I couldn't have asked for a better intro. I appreciate that. is my
I tried.
is
You
my
know,
head swelling up?
well, when you are highly favored and you get invited to the show by no other than Rodney, because those of you who know Rodney, I seen him on the show a couple episodes ago. He was like, "Yo, Terrell, you gotta interview this young lady I know," and I was like, "Yeah, any friend of yours is a friend of mine." Wait, give me the story. How did you and Rodney meet again?
See, Rodney is cool people.
Yeah.
We were in a speaker's workshop because we both speak and we were honing our craft. And just across the room, we just hit it off easy. 5 minutes, like, oh, we friends, you know? He's just that kind of guy. He calls himself the magnetic leader. And you're just drawn to him. And you know that he's pure of heart, good spirit, nice people, the kind of people you want to keep in your network. So that's how we met.
Yeah, that's him. We was me and Dr. Buchanan was chopping it up in the green room, and he had that magnetic energy, and we just when we first connected and we got on the conversation, it was easy like Sunday morning.
Exactly. Exactly. He is that guy.
Yeah, and then we almost talked way too long after the meeting. I was like, man, we gotta get on the podcast and just unravel some of this. We just did a whole podcast episode, a great conversation. So I knew when he was connected to be somebody, I knew it was gonna be easy again. Now, tell the folks where you from. Where you joining us from?
I'm from St. Louis, Missouri, the show me state. Like Nelly
Okay.
say, I'm from the loop and I'm
Look,
proud. Right.
hey, I had to go down to see the arch, and all I said is that when I went to the Louvre, I was just out there 2 months ago. I was like, I'm playing Nelly all week. That's what I'm doing.
That's the vibe. That's the vibe.
Hey, look, next time I come out there, though, like we said in the group, you guys show me where all the good eats at because I spend most of my time downtown, and now I hear there's even better food on the north side. Is that right?
That's right. You know, you got to hit the hood spots, bro. You know, whereas mom and pop cooking in the kitchen, you know?
Absolutely, absolutely. So let's dive in. I want to kind of set the stage just a little bit. Tell us a little bit about your background. You've got this impressive career. I don't know too many black physicians that work in the ER room. So like to have you on that and tell about your journey, I know that's going to be an incredible story in itself. You're a speaker, you're an advocate. What inspired you to get into medicine and then ultimately become such a strong voice for self-care and mental health?
Well, growing up, I'm the youngest of seven. I always wanted to be a doctor from about 12 years old. My
Uh,
pediatrician, she was a black doctor. She was awesome. And you're right, you don't see too many black doctors, despite what you may think, but there's 6% of doctors are black. And
mm,
my pediatrician was so caring, so nurturing, and she just poured into me. She was like, "You're smart. You could be a doctor if you want to." And I was like, that'd be cool. And I grew up poor, so I wanted to, have a better life. And I was like, you go towards what you're good at. And I was good at math and science, and I love helping people. So it was a natural progression.
Man, you know, when I look at our history when it comes to medicine, even going back to the days of, I was talking to a young lady who was talking about doulas, and like we was deep in the healthcare industry. Like, black women were at the center of all healthcare aspects until capitalism came in and modernized healthcare. But we was birthing babies. Well, I was not
Mhm.
we. Y'all was birthing babies on both sides, doing all of the ancestral healthcare for not only for our community but for the white community as well. So, and doing it in such a nurturing way. And so, I'm a little disappointed that capitalism pushed so many black women out of the healthcare space, but we need y'all back in there.
You and me both. And you're right. When there were doulas and midwives, birthing rates and health in the child care or child birthing space was higher.
Mm,
People were doing better because childbirth is dangerous.
mm-hmm.
It's a good way you could die. It's not to be taken lightly. And so having those advocates, it really improved outcomes. Right now, America has a bad maternal mortality rate,
Mm,
less than most developed nations, and then it's twice as much for people of color, women of color, in terms
man.
of dying within a year of having a baby. So you could die
Wow.
in childbirth, or you can die of a complication of childbirth, and that complication may not manifest itself a year from now. An example would be an enlarged heart, a cardiomyopathy from being pregnant.
Man. Now I'm curious, as a black woman, your personal experiences, do have they shaped your decision to how you focus on health and wellness?
Absolutely. So I feel like we need to be more proactive in prevention. I feel like you need to stay well so you don't have to get well. Because
Mm,
accessing the healthcare system, and this is from a doctor within the system, it's dangerous, especially for black folk. Often, unless you get lucky enough to have me as your doctor, because I listen to the whole person, I don't have any judgment for you. Listen, you could come in, tweak it for crack, whatever you took. I have no judgment for you. I'm just treating your medical condition. I see some of my counterparts who I know try to throw away people like, they don't matter. Every
yeah.
one of us matter. No one is more than the other.
Yeah, that is so true. Now, I want to dive a little bit into this TED Talk because, and if y'all haven't seen her TED Talk, it is amazing. Go check it out. I started it. I admit I haven't finished it yet, but we got a chance to really quickly dive into it before we start the podcast. And you spoke about a moment when you realized self care was needed, and it was a bigger part of, and it's now a bigger part of your work and message. Could you kind of, without retelling the whole TED Talk, tell a little bit about that story?
Exactly. So, you know, doctors are the worst at taking care of
Hmm.
themselves. We pour into others, and until we run ourselves ragged. And
Hmm.
actually, a statistic that I read not too long ago was that the average life expectancy of an ER doctor is 57 years old. And I was like, that's
Wow.
because we don't take care of ourselves. And I recently had a couple colleagues that one died in a call room when he was on shift, just died. And
Wow.
you're right. So now I'm like, you know that you only get one body. You got to take care of yourself. During the pandemic, I never got sick, so I worked a lot. I worked a
Hmm.
lot. I mean, I worked in a hospital, and I worked in one of our satellite locations in a rural area, and
Hmm.
it got hammered. I mean,
Hmm.
every room full, people sitting on the floor. The place was a madhouse, and it was just like that for weeks, months. When we had our surge,
Hmm.
I I just kept going and kept going. You're so busy, you don't have time to realize what's going on with you. But one thing that was happening is that we were seeing a little more death than we're used to. ER doctor doesn't like
Hmm.
to see your patient die. It makes you feel like, what did I do? Did I not catch it? But I started to notice I was despondent, and you oftentimes hear the beeping of those machines, like you hear like the TV shows. I would hear the flat lines, and that was just like it became traumatic.
Hmm.
And I felt so depressed. I even felt somewhat suicidal. Really, no,
Hmm.
no, absolutely suicidal. I won't minimize it. And a colleague of mine committed suicide during that time. So
Mm,
I was thinking, like, I'm going through my own emotional flatline. Like, your heart stops, but what about when your mind stops? And that's what
yeah,
I was feeling.
yeah, and that reminds me of that old saying that um, comes to mind because a little of your story reminds me of like the black mama story because often black mamas are the caretakers of the home, and they always taking care of everybody before they take care of themselves. And during the pandemic, I had to tell a lot of the black mamas, hey, listen, put your oxygen mask on first, right?
Hmm.
Because none of this functions without you. And we, that's why they say in the airplane, put your oxygen mask first. Because if you pass out trying to help out everybody, you no good to nobody, right?
And that's what I
And
had to learn.
yeah, now you've shared openly about your journey dealing with autoimmune conditions, burnout, and the struggles Black women face, especially in professional spaces. Can you walk us through one of your most challenging moments and how it led to your current work?
Well, hands down, the most challenging moments were trying to figure out COVID. Like, imagine they say, do this one day. Like, this is what we're doing. Like, I remember when they said, don't give ibuprofen, because that was one of the recommendations coming down from, whoever, Fauci or the CDC.
Yeah,
It was changing like head on a swivel. Like, today, give steroids. Don't give steroids. That'll kill them. You're like, what the. And so
yeah,
that was I would say that was probably my most challenging time. And the racism that happened in the Midwest
mm,
during that time, so you had overt COVID deniers. So you in here, you're dealing with the stress of actually taking care of people, trying to keep them from dying. That's stressful. On top
yeah,
of that, I mean, I've never been called racial slurs more in my life.
wow,
I would tell people they have COVID. I remember this one particular guy. I said, sir, you have COVID. He says, no, I don't. You do. You have COVID. And I said, no, you have COVID. And then he said, the N-word doctor said I had COVID to somebody on the phone.
mm,
With the hard
that's
ER.
crazy.
So, just and that wasn't a one-off. It was multiple. So while we're going through the pandemic, we're going through the racial tensions, and I'm trying to save your life and keep it cool while you're a covert racist. So that's what made it so difficult. It was a compounding effect.
Man, you better than me. I don't know how you did it because that takes. That means you had to hold all of that in your body.
I,
Wow.
I actually didn't. I didn't hold it in my body because you know what? I was like, "What you gonna do? There
Yeah,
not any other doctors. We're in the pandemic. You got me, and this is what you got." And so,
yeah,
with this particular gentleman, I took care of him and I saved his life. And he couldn't
uh,
breathe the whole time. He's being awful. He's sucking down air. And I did what I did, and he was better. And as we were wheeling him up to the floor because he was admitted to the hospital, he says, "I'm sorry, that's not me. I'm really not like that." I said, "You're absolutely like that. You need to do better." I said, "You are absolutely."
you gave him a taste of his own medicine. Yes, you is like that. You need to do better.
Because I know I cannot hold that in my body, and I wasn't going to be. I
Yeah,
wasn't mad. I was like, too bad for you. You are, you awful.
that man. I'm sorry that you even had to go through that, but I'm glad you didn't hold it in your body because, you know, I often see people when they go through that they kind of hold it in your body. I know that's not your experience, and my apologies for putting that experience on you. But you know, I think that's the toughest thing about, and hopefully you can give us some tips to how to really get through that, not to hold it in your body, and how to successfully you know move through these things that can really impact our health physically, mentally, and emotionally. Um, so that for lack of better terms, weather the storm. I think you talk about this too, the weathering effects. Tell me a little bit about that, and then
R-
some of the things that we can look at when it comes to that.
Right. So in my book, I talk about how lack of self care and holding things in actually can make you physically ill. like physically
Mm,
ill. And what happens is when you don't take care of yourself, when you're burning both ends of the candles, like many women do in particular, and specifically, like you said, Black women do. We all know a big mama that takes care of the whole neighborhood.
mm,
And so that's what happens. And so here's the deal: women, and in particular Black women, a lot of times have a gene that predisposes them to autoimmune diseases. So when I say autoimmune,
mm.
think rheumatoid arthritis, lupus,
Yeah.
so those types of things. And this gene can not come on. You can live your whole life and this gene not comes on. What brings it on? The weather and effect of stress, excessive
Mm,
wear and tear on your body, like getting enough sleep. And so Black women are at that juxtaposition of racism plus the stressors of being a female, like especially if you're a working female. So you have the double shift, we call it, wherein you go to work, take care, and then you come home, take care of the kids. Mom, what's for dinner? Help them with the homework. And so you finally lay your head down. You're not getting your full 8 hours of sleep. That
yeah.
right there, you're holding your body. And then you have things like microaggressions when you're at work. This is why I encourage people to learn to be elegant in your speech and,
Mm-hmm,
respond when there's
mm-hmm.
something that is bothering you. And so I've felt a lot better since I've learned to do those things, speak truth to power in a respectful way, wherein,
Yeah.
let's have a back and forth. Let's have a recourse. Let's,
Mm-hmm.
but don't just say whatever you do. And these microaggressions, I'm going to say, I'm not okay with that. And
Yeah.
and that helps your health, because I'm not trying to die at 57 because I'm
Mm,
holding all these things in my body. And let me tell you
yeah.
this, since I've been doing that, I didn't have to take medicine for joint pain and all of that. And I've also incorporated, and it's important to incorporate, eat real food. Stop eating the processed stuff in the middle of the aisle. Eat some real food, some real vegetables. Drink water, not Pepsi, water.
Mm-hmm.
Take care of your mental health. Don't hold it in. Talk it out. And exercise. You have to exercise. The
Yeah.
problem within our community, though, it's a setup. Because in our
Mm-hmm.
communities, but then there's no grocery stores. There's no real food. There's Dollar General with the processed food, which will make you sick. That's something for occasional. It's not for every day. There's a Popeyes on every corner. Not every
Mm-hmm.
day. Don't do that. And then the neighborhoods a lot of times are not walkable, so you can't just go outside and jog, go outside and
Yeah.
walk. And so, we are at extreme risk, especially Black women.
Yeah. And all that was done intentionally.
We know this.
And so we have to, if that was done intentionally, we have to be more intentional about, our self-care. I think you said it in one of your key messages that, self-care isn't a luxury, it's essential.
It is
Um,
essential. We have to, and
uh,
so with that being said, we need people like me, and there are a lot of Black doctors that speak about these issues, but we need to speak to our people, and let them know. Like that's what I say. You have to stay well. We need to normalize being fit and being well, because
yeah,
because the system and the game is set up to make us unwell. You
yeah,
know,
yeah. You ain't said nothing but a word. And I love some of your strategies because, and I want to dive a little deeper into strategies. Like I love the fact that you said, one, learning how to communicate in a way that allows you to release some of that and call truth to power and so forth. I love that. I love that as a tip because sometimes we're often think that we don't have a voice, so we stay voiceless, and then that keeps manifesting and eating away at us. The other thing I'm learning too is setting boundaries. I don't know if that's a thing for you. And
absolutely. I draw a
yeah,
line in the sand, what I will and I won't do, and that's a part of self care as well. Healthy
yeah.
boundaries.
And some people feel like, oh, you being unreasonable. Even your own family, like sometimes you gotta set boundaries with them too. I swear.
Listen, listen. I talk about that in my book. I do not apologize for my boundaries. Like, you know, I'm not going to every single baby shower for your cousin's fifth baby. I'm not coming. Listen, I worked all week. I'm tired. What am I going to be doing? Probably at home, sitting around watching Lifetime movies in pajamas. So
Yeah,
yeah, I just say I'm otherwise engaged. You don't need to know what I'm doing, but I need rest.
Yeah, absolutely, absolutely. Now, I'm curious to see if there's any other strategies you give to, like, especially for entrepreneurs and leaders. There's this hustle and grind culture out there. I know you had it in the doctor space,
Mhm.
but definitely in the entrepreneurs and leaders. When you think of what you've been able to do and achieve, and the boundaries and everything else that you set up, what are some practical strategies you recommend for those folks for reducing burnout and increasing overall well-being?
Well, first of all, if I've read a good many leadership books, and if you look at them, a lot of them mention self care. So
Hmm.
it's permeating the culture. No longer are people trying to grind into their die. People are trying to do like Martell says, and buy back your time.
Yeah.
So, and I'm starting to believe, the whole point of one of the major points of getting wealthier is so that you have time to do what you want,
Hmm.
but the way I understand entrepreneurship, there's a time to grind, and there should be a time where you're taking care of yourself. It
Yeah.
ebbs and flows, and and then the key is balance. I mean, work,
Hmm.
you do what you can, or harmony, really. Because
Yeah.
balance, there's going to be some lopsidedness. There's going to be some times where you're spending 12, 15 hours at work, or a lot of time traveling. I have those, but I try to
Hmm.
balance that off where days where I draw a line in the sand and say, I'm doing nothing. Turn that phone off.
Mm.
Kids, look, I'm doing nothing.
Yeah. Like, I want you to expand on that a little, because I like that word harmony. Because we always talk about balance, but I like harmony because I was using work life flow. Because, like,
Mhm.
if it ain't flowing, then it ain't going for me, right? But I like harmony. I think I might steal that one. Can you share a success story or example of that you've seen firsthand of how work life harmony plays out, whether it be your own or somebody you know?
Yeah, I'll speak on that. And I'll just use myself because I used to be one who would grind and work a lot. Extra shifts in the ER, they call me all the time. You could count on me.
Hmm.
But I could feel it in my body. I could feel that I wasn't rested enough. I'm stressed. I'm getting cranky, and my joints are hurting. My knees are hurting. My
Hmm.
back is hurting. I never had that problem. And so I had to you do inventory. What's important to
Yeah.
you? What makes what makes you light up? What do you
Hmm.
really want to do? And you need to be honest with yourself. I got some coaching. I'm big on coaching. I didn't know about it before, but I needed some guidance. And through that, they helped me see that what you got to do is take care of yourself. You set boundaries, block off time for work, and then you got to call it at some point. And so I
Yeah.
use strategies. I like there's this book I read called The One Thing. And so
Yeah.
what I do is I wake up, and I do my best work in the morning. The first few hours of the day is where I get those things done. I plan a lot, and so I have days where, like, Mondays is a meeting day, Tuesdays is social media day, and and Wednesday I usually work in the ER. Is pretty
Yeah.
recurrent. I block it like that. So I think doing what makes your heart sing and setting boundaries. Like, I will not work over. I only work Wednesdays in the ER now. Don't call me for
Nice.
Saturday. I don't do that. I'm at that point in my career. You know, the
He's like,
administrator,
I don't do Saturdays. You better get somebody else.
get go get a youngin because I've earned the right to say. And so
Yeah.
and so I do the things that I like. I like speaking. I like teaching.
Yeah.
And I just can't quite give up the ER just yet. I still like the adrenaline
The
and all of that.
adrenaline rush.
A
Yeah.
little bit, and then I like my patience sometimes.
Yeah. Wait. So the getting on stage don't give you that same adrenaline rush, or no, or is it different?
The shake, clear, shock. Oh, he's dead. Now he's not dead. You
Okay, that's a
undid
different type of rush. That's a
you
different type of rush. Okay,
undid
all
somebody. That's not quite the experience I get on
right.
stage.
Okay, all right. I get it. I get it now. So, uh, I'm over here thinking too, because I think about some of the the black mamas out there, and um, my sister, ancestors and those folks in the community, and in my community, and they often feel guilty about prioritizing themselves. What's some advice that you would give to somebody like that? What's the first step that they can take to shift that mindset of
I, I,
that
I
guiltiness?
I get that. I used to have that. But and that's why I use the metaphor of the oxygen mask. So, you imagine you're on a plane and what if it goes down and it decompresses and you need to get oxygen, but your baby is there with you, your 4 year old. You're thinking, I got to take care of my baby. I got to take care of my baby. Yeah, if you put the oxygen mask on your baby, now you're dead. And the
Mm-hmm.
baby is by himself. Nobody is going to be taking him. So he's going to be dead soon too, a slow, agonizing death.
Mm,
Okay. And so if you're the mother and people count on you, that's my position. And what I have to do is take care of me, make sure I'm healthy, I'm eating right. I get my checkups, get the mammogram, get the colonoscopy, that I'm good and that I have enough energy to pour from my cup into others. Because
mm,
if I burn me out, I'm no good. And then I
yeah.
can't give my gifts to the rest of the world and everybody else around me suffers. So that's how and I have to have this conversation, as you can imagine, over and over and over
Mm-hmm.
with my Black female patients.
Mm-hmm. Yeah. And I think it's something that we're going to have to continue to have conversations over and over because, the unfortunate part about this conversation, when you think about trauma, trauma is passed down, and then all of these things are inherently passed down or ingrained in us, and so it's going to take a while to unlearn them. And so, I'm glad we have people like you that can be a gentle reminder and advocate for us to do it differently, do it better, and keep pouring that into us. So I appreciate that so much. I'm thinking about your journey, and looking back at your journey from overcoming health challenges to becoming a speaker and advocate. What would you say is the biggest lesson you learned about self care and success?